could join me today because this is very important. A lot of people struggle with posture. They want to improve their posture and alignment because when you have better alignment and better posture, your health is better in general. The muscles function better, circulation's better, nerve flow. You just feel more well balanced, and long term it's better for you. So we're going to talk about different recommendations that I give my patients for posture. You should always check with your own health professional before you do any of these stretches or exercises, because there's a right time to do these exercises during the course of care. So I customize these recommendations for my patients at a certain point along the way in their care. And your chiropractor, your health professional might want to share these exercises with you at a certain point in your care. I've practiced for over 25 years now, and currently I'm at the Landmark 4 in Kelowna. I've seen over 10,000 patients. A lot of those patients early in my career when I did locums, and locums are, that's when you take over for a chiropractor that's away from their clinic, whether they're on a holiday, they've been injured, maybe they are sick. And my job when I first graduated from chiropractic school was to take over for these chiropractors. So I basically took over their practice for a week or two at a time, and I saw hundreds of patients every couple weeks from this locum experience. And so that really accelerated my learning curve, and it really helped my clinical skills. And so the first 3 years of my practice, I had about 50 clinics or 50 clients that I went from clinic to clinic, taking over for the chiropractor. And then since then, I've had my own practice. And for 15 years in Winnipeg, and now since 2008, here in the Okanagan, in Penticton, and in Kelowna. So I want to talk a little bit more about posture today. And if you can see my slide here on the screen, if you're with me on the website, you'll see my slides. If you're on Instagram or on Facebook, you're not going to see my slides, but I'll upload this video later on Facebook so you can see it, or on YouTube. So for postural exercises, this helps the alignment of the body. It helps the muscle function. It helps with circulation, because when you have better symmetry, better alignment, the blood flow, the venous flow is going to be better. The nerve flow is going to be better because there's not going to be compression in certain areas of the body. So you're not going to get that compressed nerve, that slow circulation, that numbness and pain, discomfort, the muscle cramping that we get when there's poor alignment. And the other thing is we want to build up strength in certain areas, because when we are working on posture, we want to make sure that the body gets stronger and it can hold that position. So basically, as we're doing these adjustments to realign the body, improve your posture, we want you to be able to maintain that posture long term, so you don't go back to the way you were before. We don't want you to come back with the same problem and then just keep spinning our wheels, keep doing the same thing over and over again. So we really want to see good results, move you forward, and help you to maintain your own health long term. So these postural exercises really help with the care that we provide in the clinic. One of my favorites is called the cat and the dog. These are yoga positions, and I give my patients this type of yoga stretch very early in care. After a couple weeks of care, I'm usually recommending the cat and the dog. The cat is where you're flexing your body forward and your head forward into this arched, flexed position. And I tell the patients to hold that for 1 second and then go into extension, or the dog, and do that for 1 second as well. So there's a fluid movement between flexing your back forward and then extending your back backwards. And that's going to stretch both the ligaments on the back part of the spine, the posterior ligaments and discs, and then the anterior part of the spine, the front part, where it's going to stretch the ligaments and the discs and open up the discs in the front. So this cat and dog alternating yoga postures really help the body to pump some fluid into the joints, help with the circulation, as well as stretch the ligaments and the discs, which is going to make it easier for us to do the adjustments in the clinic, and it's going to keep you more flexible. So that if you shift in your chair, maybe you go to stand up, that your body's more flexible and it can adapt quicker than if it's stiff and rigid. So the cat and dog is one of the first stretches that I give my patients. The next one is called the plank. And the plank is where you're on all fours on the ground, your body's parallel to the ground. You extend one arm out and then the opposite leg back. So you're balancing on the opposite arm and leg. And what that's going to do is it's going to balance your posture, and it's going to require you to activate some core muscles that are going to support the spine and the area around the spine. So this really builds up strength around the spine. And I usually give this plank exercise later on in the care. So the first thing is we want alignment and flexibility, the patient feeling better. Secondly, we want to make sure that the patient's building up strength, and the plank is good for that. I usually tell the patient to hold for 5 to 10 seconds and then switch to the opposite arm and opposite leg. So you're basically supporting yourself on your knee and on your hand on the other side. And so you do that, holding that for 5 to 10 seconds, and then repeat, switching between sides for 3 to 5 times. And then the other exercise I like is called the halfway lift. The halfway lift is when you're standing with a slight bend in your knees and you bend at the waist to touch your toes, but you keep your upper back flat or parallel to the ground. So we don't want you to flex forward and arch your back completely. You're pivoting at the waist where the lumbar spine meets the sacrum or the hips, and you're pivoting in that spot and then reaching down for the floor with a slight bend in the knees and a little bit of flex in the hips too. So what that's going to do, it's going to open up that key hinge between the fifth lumbar and the first sacral segment. Most of the back issues we see are at L5 and S1. It's a very common transitional segment. So the halfway lift is really good at getting flexibility in that hinge joint and then bringing some stability into it, because we want you to hold that position parallel to the ground for 1 to 3 seconds and then slowly stand up again, and then go back into that hinge position for 1 to 3 seconds, slowly stand up again. And that's a really good activity to do. I usually say 5 to 10 repetitions of this one, and that'll take you a minute or two. The last one is called the bridge. And here on this slide, I'm demonstrating how I do the bridge. So you want to start flat on the ground on your back, and then you want to lift your hips off the ground with your feet firmly planted on the ground and your shoulders fairly firmly planted on the ground as well. And that's going to create a flat torso, so that you're from your shoulders to your knees, you're in a linear line. And so that bridge type of yoga posture is going to help work the front part of your spine. It's going to work the abdominal muscles. It's going to work the obliques. It's going to work the pelvic flexors. And what that's going to do is it's going to build up strength around your core, but on the front side versus the back side. So there's a lot of exercises that work the back side for core strength, but we really want to make sure we're working the front side as well and balancing the two out. And for the bridge, I usually tell people to hold for 5 to 10 seconds and then relax, take a break of a few seconds, and then back to doing that for 5 to 10 seconds again, keeping an eye on the mechanics, making sure you're doing this properly. So go slowly, it's not a race. Hold again for 5 to 10 seconds, and then do this for 3 to 5 repetitions. And that's really going to build up that core strength, especially in the front part of your spine. So there's 3 really good exercises for you guys. Again, if you can't see my slides because you're on social media, I'll be uploading this later today or tomorrow morning on our YouTube channel. It's at Dr. Cary Yurkiw, or on Facebook. Join our Facebook page for the clinic at Dr. Cary Yurkiw, and then I'll upload this video and have a post on our blog on our website as well. So there's many places you can get the slides and see the recording. Join me this coming Friday. I'm going to have, this coming Sunday, I'm going to have coffee with Dr. Cary. So if you have any questions, please comment or PM me. I'd be happy to answer your questions directly, but also save some of these questions for coffee with Dr. Cary on Sunday. It's a little bit more of an informal meet and greet where you can join me and you can ask some questions. I usually have a coffee on my desk, and we're just chatting about how the week went in the clinic, some of the conditions that we saw, the types of treatments we're doing, the recommendations we're making for our patients, any new research I've done. So really, we're just kind of sharing the current events of what's going on in the clinic and what I'm looking forward to for the week ahead. And the last thing I want to tell you about today is our special offer. And the special offer is $15 off for new clients to the clinic. So if you're a new client, we can usually get people in within 48 hours into our clinic. We are open 7 days a week, including late on Tuesday and Thursday until 7. So tonight we'll be in the clinic till 7. And for $15 off, you just have to type in www.drcaryurkiw.com/15off. It'll take you right to the page on our website where you can book the appointment. We'll know that you were on this webinar, and you'll get $15 off your first visit. Usually we can see new patients within 48 hours. You don't need a doctor referral, and we do bill directly to insurance, including ICBC. So it's really easy to come in and see us at the clinic. We have some digital x-ray. We have a digital x-ray in the clinic if we need to take x-rays. We have shockwave and laser therapy now in the clinic too. So we've got a lot of different technologies we use in conjunction with chiropractic care. So thanks for joining me today. I hope you learned something about posture, chiropractic, and alignment, and I'll talk to you guys soon.